Good morning everyone. For today's video, we will focus on Health Component Quarter 1, Module 4 to Module 7. Most essential learning competencies explain the proper health appraisal procedure and demonstrate health appraisal procedures during adolescence in order to achieve holistic health. Our first topic is health appraisal and screening procedure. When we say health appraisal, it is a series of procedures to assess or determine the health status of a learner. Screening for blood pressure is added to the routine test for height, weight, vision, and hearing. Immunizations are also updated. For girls, it is recommended to check your breasts for possible masses or lumps the moment you start menstruating. You should do this monthly, specifically 1 week after the onset of menstruation. You can do this while taking a shower or facing the mirror. This breast self-examination or BSE can help females check any abnormalities that might need medical help. How to examine your breast? First step, lie down on your back and place your right arm behind your head. Use the finger pads of the middle fingers on your left hand to feel for lumps in the right breast. Use overlapping dime-sized circular motions of the finger pads to feel the breast tissue. Second step, move around the breast in an up and down pattern, starting at an imaginary line drawn straight down your side from the underarm and moving across the breast to the middle of the chest bone. For the third step, repeat examination on your left breast, putting your left arm behind your head and using the finger pads of your hand to do the same. And for the last step, while standing in front of a mirror with your hands pressing firmly down on your hips, look at your breast for any changes in size, shape, contour, or dimpling, or redness of the nipple or breast skin. Scoliosis screening. When we say scoliosis, it is a condition in which the spine curves to the side. It is an abnormal lateral or side-to-side curvature of the spine. This condition commonly develops during sudden birth of the growth of adolescents. It affects girls more often. This condition can be corrected if treated early before the bones have fully developed. The following signs should be referred to a doctor for treatment. One of the shoulder blades is more prominent. The head is not aligned to the center of the pelvis. A hip appears higher or is more prominent than other. The rib cage is uneven. The waist is uneven. The entire body is leaning to one side. How to self-examine the testicles and the scrotum. Take a shower or bath to ensure the scrotum is relaxed and warm. Stand in front of the mirror if that helps you to visualize. Examine each testicle separately, one at a time. Use the fingers and thumbs to check for lumps, protrusions, or painful area. Feel under the scrotum to locate epididymis. Examine the other testicle. Other example of screening test. Medical examination keeps you informed about your general health status. Dental examination keeps you informed about any dental problems. Height taking gives you an idea about your growth rate. Weight taking keeps you aware if you are within your ideal weight. Vision test keeps you informed of your visual acuity. Scoliosis test keeps you informed of any abnormal curvature of your spine. Breast self-examination keeps you check unusual lumps. Hearing test keeps you check the ability to hear the loudness and pitch of the sound. Most essential learning competency avail of the health services in the school and in the community in order to appraise one's health. For our second topic, health services in school and community. When we say health service, it is a public service providing medical care. Health services consist of medical professionals, organizations, and ancillary health care workers who provide medical care to those in need. Health services serve patients, families, communities, and populations. They cover emergency, preventative, rehabilitative, long-term, hospital, diagnostic, primary, palliative, and home care. These services are centered on making healthcare accessible, high quality, and patient-centered. Our government believes that a strong nation needs healthy citizenry. In order to achieve this, the Department of Health promoted community health with a partnership of Department of Education, community, barangay, government, and non-governmental organizations through the program called Primary Health Care. Primary health care programs in the school and community. Dental health program. Conduct dental-related examinations and procedures like extractions of milk teeth, giving prescriptions for toothaches, and etc. Medical morbidity clinic. Provide free medicines for simple health problems prescribed by medical practitioners assigned in a community or school. Example include stomach ache, fever, cough, and colds. Child health care. Conduct immunization for children since their immune system is relatively weak. This includes vaccine for measles, mumps, polio, and influenza. Nutrition program administers Operation Timbang to ensure that children's mass is appropriate to their age. This is commonly called BMI or body mass index. Deworming. This service aims to eliminate intestinal parasites in children through asmebendazole. This is being done every January and July, National Deworming Month, and has been a goal of Department of Health since then. School feeding. This service aims to improve the nutritional status of students by providing free, healthy meals. It helps in increasing the attendance of students as well. Medical checkup checks and informs children of their general health status such as weight, height, eye condition, and heartbeat to guarantee good health and to provide early detection of diseases or abnormalities. Mental hygiene provides centers for adolescents suffering from problems like depression, abuse, and stress. These centers helps in overall psychological well-being of the students. Blood testing checks and tests components of the blood for possible disorders and conditions like anemia, leukemia, and blood infection. Pharmacy services delivers medicines to health centers for easier access. Examples are medicines which are badly needed by the local in the community. The mentioned services must be made available for free in your community and in school because they are subsidized by the government to ensure that your health is being protected. Yes, they are available and must be given for free. Most essential learning competency. Apply coping skills in dealing with health concerns during adolescence. Coping skills will help you to deal with sad, difficult, and stressful situations or experiences in your life. If you have coping skills, you can prevent serious problems resulting from these experiences. These are several coping techniques you can use in ordinary life situations. Some are very useful, some are not. Some can help you for a short time only, while some can help you for a long time. Read the following techniques of coping and see if this relates to your coping skills. Number 1. Positive problem solving strategies. Be careful and study your action. Make a plan of action. Look at the problem as a challenge. Be creative in solving the problem. Come up with the different solutions to the problem. Number 2. Support seeking strategies. Always talk to a friend who can do something about it. Ask advice from responsible family members or relatives. Talk to someone to find out more about the problem. Look for someone who will sympathize with you. Seek professional help. Positive reframing strategies. Self-talk is always to help you change your thoughts. Here are some self-talk statements that you can use as coping skills. These statements are useful when you are under stress or facing a challenging problem. When you are preparing for a stressful situation, you can use any of these statements. When you are facing the challenge or problem, you can use any of these statements. When you are coping with fear, you can use the following statements. For self-congratulations, use the following statements. And for affirmation, you may use the following statement. Self-management skill is your ability to manage your personal reactions to responsibilities and challenges in life. This involves managing your time and adapting to changing situations. Having self-management skills requires you to develop the following background skills. Remember, self-management skills are important skills in attaining holistic health. Steps in decision making. First, state the situation or problem. Examine the situation or problem and ask yourself. Second, list all possible options or alternatives. What are possible choices or alternatives you can make? Ask for their opinion and advice. And lastly, weigh the possible outcomes. Thank you for watching. I hope that you have learned a lot from this video.